So, hello, good afternoon, everybody.
Hello.
Here is the operational help desk of the Endo-ERN. My name is Danielle Steenvoorde. I'm from Leiden, the Netherlands, and this is my colleague.
Hello, my name is Isabel Mönig. I'm from Lübeck in Germany.
Okay, I hope you can hear us. If not, you can raise your hand by clicking on the button, or you can write a question on the right. So we will start, and I will start the presentation, and after that, Isabel will guide us through the steps of getting access, and at the end, I will give you a presentation in the training environment. We will give you an introduction, what will help you to get started with CPMS. This PowerPoint, this webinar will be recorded, and it will be sent to you, and also the other affiliated partners who are not able to attend today. What are European reference networks and what is CPMS? ERNs are virtual networks for rare diseases. And the cooperation between these centers will cause the expertise to travel rather than the patients. And this is possible with the use of the clinical patient management system. This is a virtual consultation platform, and that is operational since 2018. CPMS is a secure web-based application, and it will realize one of the ERN's core tasks, and that is bringing expert specialized care to all patients in Europe by allowing virtual consultations across national borders. So how does it work? The patient can have his or her treating physician in an Endo-ERN reference center, as you can see here in the picture, or a treating physician in a non-ERN center who can contact one of the Endo-ERN reference centers. And via CPMS, any doctor can ask for virtual consultation, and the IT platform CPMS will enable a multidisciplinary team to discuss these specialized patient cases in a secure, closed-off environment. And the resulting advice can then be directly referred back to the patient by his or her own treating physician. So what will we cover today by this webinar? We will talk a little bit about CPMS for affiliated partners. We'll talk about the security and privacy issues of CPMS, how to get access, and we will give a demonstration in a training environment, and if there's time left, you can ask your questions. So CPMS for affiliated partners, this is cited from a guidance document regarding the access to CPMS for affiliated partners from the DJ Santé ERN team. So all associated national centers for which they have received a signed bilateral agreement, they were uploaded to the database and they're already ready to use the CPMS. And this database is being updated on a weekly basis. And it is their advice that the associated national centers will identify one healthcare professional that will be in charge of all CPMS activities for that national center. So, security and privacy of CPMS. It's good to know that CPMS applies to the general data protection rule and it is safe to use. And all the relevant security documentation regarding this issue is available on the CPMS website. So if you encounter any national or institutional barriers about implementation, please refer to the national and institutional responsible authorities to the key document from the European Commission. So where can you find these documents if needed? Then you have to go to this website, and then you will see this dashboard. And over here are the usual manuals and documentations. And the most important one is this, the good practices of the informed consent. So the next slide gives an overview of all the relevant documentation. I won't discuss all of them, of course. It's only in here because you will get this presentation. So if needed, then you can look in this list to give the documents. Okay, about the CPMS informed consent forms. Of course, also for this, you need to get informed consent from your patients. Informed consent must always be obtained in order to be allowed to enroll your patient in the CPMS. On our website, we have uploaded the different informed consent forms in all kinds of languages. And if you need one in your language and it's not in this list, please let us know. And also the link for this you can find below on this slide. So this is an example of the English patient consent form. So here's the information what you can read or your patient. And on this part, you can see that there are 3 types of consent. The first one is the consent for care. That one is obligated in order to discuss your patient in CPMS. And the other 2, the consent for the ERN database or registry and the consent to be contacted for research in the future are optional. Also about the privacy, there are some, it's good to know that there are de-identification mechanisms in CPMS. There's a CPMS ID that's automatically generated by the system. And it's only visible for the health professionals within your own hospital and not for the other hospitals. So this is what you can see over here. If you make a patient panel, what we will show you later, the panel also gets a panel ID. It's also automatically generated by the systems, and there's no connection to any patient data at all. It's always shown in the panel either. You have to choose a nickname for your patient if you enroll your patient. And it's important that the nickname doesn't consist of any information regarding the personal data of the patient. And the last thing about the identification, it's possible to upload images in CPMS, and if you use DICOM images, the system will anonymize it automatically. But if you upload other types of images, it is your own responsibility to anonymize your slides. So it doesn't contain any identifying data. So next is to get ready for the use of CPMS about registration, and my colleague Isabel will guide you through this part.
Yeah, hello. So there are different steps you need to go through to get access to CPMS. The first time you want to log into CPMS, you have to request access. That will take about 15 minutes. Afterwards, you don't need this time anymore. You can just access to CPMS. When you log in at CPMS for the first time, you need to set your preferences there. This is also a one-time action, and this will take about 5 minutes. And I will guide you through these steps afterwards. When you've logged in CPMS, you can start your patient consultation, and Danielle will tell you about this in the training environment. Okay, first, if you want to get access to CPMS, you need to create an EU login. This is the basis to get a CPMS account. I will tell you about these steps afterwards. You have to add a mobile phone number in step 2 to your EU account to use this one to get access to CPMS. And in the last step, you need to request access to CPMS via the secure authentication and authorization system. To create an EU login, you have two different ways to go to that website. The first one is to go to the main Endo-ERN website and to click on members at the top of the website. You see it in the red box. If you click there, you will be transferred to this website, and you need to click on the upper green box to request authorization for CPMS. The second way to go there is to go to the main CPMS website, where you would log in afterwards as well, and to click here to create an EU login. With both ways, you will be directed to this website, where you have to click on create an account. When you do that, you will get to this website, and you have to fill in all the required information, your name, your email address, and then you can click on create an account, and you will get a confirmation email with the link. This may take some minutes, sometimes it takes like 10 minutes or so. Just wait for it and you will get it. When you click on the link in the email, you will get to a website where you can choose your password, and afterwards you can go again to this website, which is indicated here on the slide, where you can continue with the access process. You have to fill in your email address here and click on next, and then you can fill in your password, which you've chosen before. Please choose password as your verification method. That's enough for this step for your EU account, and then you can sign in. If you've signed in, you will get to your EU account, and there you can change all the information. You can click on the icon next to your name on the right side of the page and go to my account. There you can change or insert your mobile phone number and change it as well if your number changes at any time. Please make sure that this is a number of a phone you always have with you when you want to use CPMS, because you need it afterwards to log into CPMS. So that's important that this is the same number. Okay. So now you've got your EU login. This was the first step. Now you have to request access to CPMS. So you go back to the main CPMS website, which we told you about before. This is the link is indicated here on the slide again. And now please click on to request authorization to use the CPMS, which is there in the red box. Then you are in the SaaS, where you can where the CPMS request is going further. You have to select an application. So this is CPMS, of course. And if you've chosen that, you can click on the green button and step 2, select an organization. So if you click there, you will be guided to this window. So you have to choose CPMS again and click on the green button to request access. And when you've done that, you can choose CPMS again and then click on step 2 to select an organization. It is very important that you follow all the steps we are telling you now, and that you don't skip any of these steps. The system won't tell you that this is wrong, but we would have to reject your request if you don't fill in all the information. So if you just follow all the steps we are telling you now, then it won't be a problem. Okay, so now you're on the side where you can select your organization. So this is, of course, Endo-ERN, so please choose Endo-ERN, and afterwards it's important to click on open next to Endo-ERN and not on the green button, which is also at this website. So if you click on open, the next window will be seen, where you can choose your country. So there again, please choose your country and don't go to the green button, but click on open next to the country you've chosen. So if you click on open, then all the healthcare providers of your country will be opened, and they of course choose your HCP. And now you are allowed to click on the green button at the bottom of the page to go to step 3, select an access profile. So now you have to think about which profile you need, which which access profile you want to fill in. So most of you will be healthcare professionals, so you have to choose HP. Some of you are maybe researchers as well. You have to you can choose more than one access profile. Yeah, so if you okay, then you can go further on, and if you want to write a comment there, you can do that, and afterwards you can submit your request. Now, then it will may take some time, some days, until you get a confirmation email with a username. And if you got that, you can you log in for the first time at CPMS with your password, and which is the same password as the password from your EU login, and with your email. So now that you've logged in, you have to set your preferences for the first time. That means that you have to choose all the main thematic groups which you have your expertise in, so the other experts can find you when they are starting a panel. It's very important that you just select the MTGs that you have expertise in, of course, and it's also very important that you just choose the MTGs which your HCP is endorsed for. You don't have to choose every MTG which is in your HCP, but you can't choose more than these which your HCP is endorsed for. So when you log in for the first time, you go to the CPMS website again, the one you've been before, and go to login via EU login. When you click on that button, you can fill in your username or email address and your password, and then you need to choose a verification method. The easiest way is to choose mobile phone and SMS. That's why you had to add your mobile phone number. You fill in your number, and you will get an SMS with a code which you can fill in, and afterwards you can log in. There's also a possibility to download an app which you can use as verification method. By the way, with the SMS is the easier one, so you have to see which one you prefer. So this dashboard have you seen before? Danielle explained it to you, and when you log in for the first time, you have to click on ERN at the right side at the top of the website. Then you will be guided to this window, and you can click on preferences on the left side of the window, and then you have to fill in your professional role, for example, endocrinologist or surgeon or whatever you are, and then you have to choose the thematic area, so the one you have expertise in and your HCPs are endorsed for. Then you can click on update my preferences, and then it is set for all the other times you will log into CPMS. So this is the thing you just have to do once. Okay. Here you see the dashboard again, and Danielle explained to you the right side of the dashboard. There you can see all the manuals and the patient consent form, for example. In the middle of the website, you see all the training videos and older webinars. If you want to listen to one of these again to get to know CPMS better, every step of the panels are explained there. And on the left side of the page, you see the button center. There you can see all the patients your HCP has enrolled in CPMS, and with the ERN, you get to the dashboard where you see all your tasks and the panels you're part of, or the meetings which are coming up. Yeah. Okay. So now we would like to show you how you can enroll a patient and how to start a panel, because these are the most important steps, and Danielle will show you this one with a training environment.
Okay, yes, so I will give you a live demonstration. So this is the training environment of the CPMS. So this is the page that you saw before. And here you also see the same dashboard, and it's important that you choose some center or ERN. Now first I will let you see the ERN. This is for the whole Endo-ERN. So if you have been invited to a panel, you will see this over here. So right now, at the moment, I have no unanswered invitation at this time. You can see your own panels that you've started, the panels that you're contributing in, and you see your task list. So here I have a task, please review the data that is provided for this panel. And you can also see if you have an upcoming video meeting. But for now, I will show you how to enroll a patient and start a patient panel. For doing that, you have to go to Center. So that's your own hospital. And now you see another dashboard. And over here, you can see the patient list. That are the patients that are already enrolled. And for now, I will enroll a new patient. And then you see this first page. So you have to choose the date today. They still have this question in it, but I always choose no, it's not that important. And here is the information about the patient-informed consent. So as I told before, the first one, consent for care, is obligated. You always have to get that one. The other tools are optional. And identifying data, here you can choose to fill in the real name of your patient, because this information will only stay in your hospital and it will not be shown to the other experts. And choose the gender, date of birth. So the system automatically makes a record label. And if there are no red fields anymore, you can enroll your patient by clicking on this button. And of course, I have to confirm that I'm aware of my relevant data protection responsibilities. I confirm. And here you see that, of course, no panels have been created for this patient yet, so I will open a new panel. Now I have to choose a nickname. And here you see, do not use any nicknames liable to identity the patient, because this is the name that the other experts will see in your panel. Yes, I have urgency for this panel. This is the first panel. Here you have to fill in the consultation request. And your healthcare provider, point of care specialist, is that yourself or is that somebody else from a non-ERN center? And I choose Endo-ERN. You have to choose the panel lead. Well, most of the times it is yourself. And then you choose in what of the 8 main thematic groups the disease of your patient belongs. So I choose pituitary. If needed, you can choose a secondary thematic area, but that's optional. And after doing this, I create a panel. So this is how the panel looks like. I will give you the information about the different parts. So over here, you see the number of the panel and the nickname you've chosen. This is the name of your center, the lead of the panel. So that will probably be yourself. Which ERN, Endo-ERN, and thematic area which you've chosen, pituitary. Okay. Over here, you see in what stage of the panel you're in. Now we are in open. And in open, what you can do is, I will show you later, is fill in the patient consultation form. If you have done that, you can continue to panel selection. So you have to click on Next. There's a button over here. And in panel selection, you can choose your panel members. After doing that, you can, if needed, you can complete your data by editing the consultation form. And I will show you later that you can schedule a video meeting where you can discuss the case with the experts that you've invited. And if your panel is finished, you can write the outcome document, sign off, close. And if you're completely finished, you can archive your panel. Over here, you see the timeline. So you see over here that a new panel was started and that there's a patient document. And what you also can see in this timeline is when you've created a video meeting or what the panel members are of your panel. So let's go to the consultation form. Over here, you see the standard consultation form of CPMS. It's good to know that we are in the middle of the process of creating a customized patient consultation forms for every MTG, but it will take a while before they're implemented. So for now, we have to use the standard form. And over here, you can see the different tabs, the patient information, episode description, family history, medical documents. It's very, there are many options and you don't have to fill in all of them. So I also won't show all of them, but just a few to give you a little bit of an idea. Click on it and click on it again. So age when panel was opened, 18, fill in the country, Argentina. So only the ones that are red are obligated to fill in. And episode description. Over here you can add main symptoms, current treatment, exam findings, laboratory finding, a lot of things. So let's just choose one, add main symptom. Just use text, that's the easiest thing. Headache, cold, weight gain. And so you can choose all of them, what you need for your case to fill in. And if you are done, you click on Save. So over here now you can see your consultation form with the new information that you filled in. So I click on Next to go to panel selection, continue to panel selection. Sometimes it's a little bit slow. Yes. And now you see new buttons over here. You can invite members, you can already schedule a meeting, or if you're an invited panel member, you can request additional data by the panel lead. So if you want to invite members, you click on this. Over here you can see the available experts, and then you can choose your own MTG or one of the others. And you can select the different experts, or you can choose to invite all. This step will show you who has already been invited and also who has accepted the invitation, because everyone who gets invited gets an email and they can accept or refuse the invitation, but you as a panel lead can also accept or refuse the invitation yourself if needed. If you just don't know or need our help, you can ask coordinator assistance by clicking on this button. So the members are invited. And if they have accepted or refused, you can continue to next to data completion. It's important to know that in this stage, you are not able to edit your patient consultation form. You're only able to edit that if you are in the next stage, data completion. But still now the system has a little bit an issue that they will change it. But if you go to a data completion before the members have reacted on your invitation, they will all get refused automatically. So let's go to data completion. Then you will see this. You have invited panel members who have not responded. And if you continue, their invitation will automatically be marked as refused. You can do two things in this situation. You can accept the invitations by yourself, as I have shown you before, or you can wait a little longer to give them the time to accept it. But for now, I will continue to data completion. And then over here, you can see you can edit your form again. So let's schedule the meeting. Here you can choose if it's a part of an ERN recurring meeting. And we have recurring meetings for all the different MTGs. But if that time is not suitable for you, you can choose an individual meeting where you can choose the date yourself, the time and duration, or you can choose the proposed meeting where you can choose time slots. As many as you like. And the invited participants will have to choose which of these dates they are available. So I finished, I scheduled the meeting. Now it's important that you don't click on close, what you would intuitively do, because you have not invited the participants yet. So you have to go to this step, participants, and then you can invite some of the members to your video meeting. So there are two different things. You have a panel. You can invite your experts to your panel, then they can read what you've written. And the other thing is that if you schedule a video meeting, you also have to invite the experts. So if you're done, click on close. And if the meeting is there, there will appear a button, join the meeting. And we have more information about how to schedule a meeting or join a meeting, but we won't discuss it right now. So this is how these are the basics of a patient panel. What we told before is that there are training videos over here where you can find more information about things. And it is the general user manual. So after this webinar, get started with CPMS. So what are the steps that you have to take? First, request access to CPMS. So identify one healthcare professional in your hospital that will be in charge of all CPMS activities for your center. Follow the steps that we've mentioned in this webinar. And if you need more information, you can watch the official CPMS training videos that I've shown you and read the official CPMS user guide. And we've also made our own standard operating procedures and manuals on which you can find on our website, but we can also send it on request by email. And if you want to practice with a test panel in the training environment that I've shown you, please let us know. And it's important that you should use a training environment for test panels and not a production environment, because that will generate many fake panels that will give problems with monitoring of the use of the systems. So if you have questions or problems, please contact us. So our name is Isabel Moenig and my name is Danielle Steenvoort, and we have a general email address. CPMS helpdesk at endo.ernet.eu. And there's also a core help desk in Brussels. This is the mail address that you see over here. Most of the times, if we don't know how to help you, we will forward your question or your problem to this help desk. So this is the end of our demonstration. So please let us know if you have any questions. So we will send you a recording of this webinar, and we will also send you the PowerPoint that we've shown you. And please also go to the Endo-ERN website, where you can find our manuals and also the information about CPMS. And on the CPMS website itself, you can find a lot of documentation. And please don't hesitate to contact me or Isabel by email. And we always try to respond as soon as possible. And it's our job to help you with this process. Okay, I'll check just one time if there are any questions. And if not, I think we can end this webinar. I don't see any, do you?
Yeah, I see one. The difference between the Endo-ERN database and Eureka is asked. Oh, what is the difference?
That's a good question. I don't have the answer for you right now. I only know that the CPMS database is not being used until now yet. I think it's more like an option for the future that's available in the system. But I will look it up in detail, and I will send you the information about. Well, thank you for attending this webinar, and we will see your request for access, and don't hesitate to contact us by mail.
Okay, bye-bye.